Kevin has, and he's going to control what SimMan does. So he makes him blink, breathe, move, talk, groan, whatever we want him to do, he can do. We can change his heart tone. Go ahead, Kevin. Give him a little demo. Off. This is Mark. This is the simulation. Make him gag now. Yep. That is nice. Very good.
Why have we just ate lunch now?
So he can put him into VT, so we can change his heart rhythm. And the nice thing is, when you change his heart rhythm, his pulse actually changes also. So when you're checking his pulse, you can see that he's going to be pulseless if he's in VT. If he's in a high rhythm, you're going to be able to check his pulse and feel that his heart rhythm is high, whatever. Yep. Can you feel it? He's got good pulses, actually. He has veins that you can poke. We can fill him with, so we can silence the alarm just like in real life. All right. There you go. Didn't work.
Oh, there you go.
There you go. Yeah. He has breath sounds. We can change his breath sounds. He can have wheezes, he can have rails, he can have crackles. He's anterior and posterior. You can listen both. He has vowel sounds, so you can listen to his belly. You can hear whatever you program in. That's what he's going to have, hyperactive, no vowel sounds, whatever. His heart tones can be changed. He can have a murmur. He can have a rub. What else is listed there, Kevin? All kinds of things. You can simulate whatever you want, really.
We can have different heart tones. We can also look at different airway.
Yep, different airway issues.
Actually, very often occurs in the real world. And this is good because it kind of sharpens the staff awareness of how quickly patients can change.
So can you make him have trismus? See how his jaw goes up. His tongue swells. You can have his tongue swell, so it blocks his airway. Very cool. Let's see, head to toe. Let's go. So you can do sternal interosseous, which we would never do, but if you had a medical student that, or maybe one of our, residents that come would want to practice on that, they can do that. Excuse me. If I disrupt anyone here. Blood pressure, he has a blood pressure, so you can take his blood pressure, you can change his blood pressure, so his blood pressure will change here. So say you want to change his blood pressure and you want the student to figure that out by themselves, you can change it. They have to take their blood pressure, tell you what it is. He has a pulse ox on that if you take it off, it goes off the monitor. So it actually has to be on him to work or on something. It has to break the... He is anatomically correct. I don't know if anyone wants to check that out after they can. He has femoral pulses. Pedal pulses. He can be a she. We have interchangeable parts.
Yeah.
He can be catheterized. So you can catheterize him and actually get urine out of him. Not real urine, obviously, but yellow colored water. What am I missing? My list, huh? He can have stomach distension. He can be intubated orally or nasal tracheal. And he can have a chest tube, which we don't see a lot of chest tubes, so that's kind of cool. So we could really simulate that for competencies. He can have laryngospasm. Spontaneous breathing. You can change his respiratory rate. He can breathe faster, slower. He can have audible wheezing, all that. You can do CPR on him, and when you do CPR, you can actually see on that computer whether your chest compressions are the right depth or not, and it really talks you through it, which is very cool. It's like the old simulators we used to use. You can, like I said, sternum ID, you can have I/O access either sternally or in his tibia. Bowel sounds fully, and then Kevin can actually, like if you, he also came with a camera, so we have a camera that comes with him, I didn't bring it down. And it records whatever you're doing, so when you're in there and you're doing a simulation with students, you can record it and then you can look at it after the fact and say, you know, oh, maybe you should have done this, or did you do this? And they'll say, oh yeah, I did that. Let's look here and see if you really did it. So it is a good learning tool. It's not punitive, it's to learn, really, more than anything. So you go through the scenario and you say, okay, when it got to this point, maybe you should have done this. And we can make him respond however the students respond. So if the student does something wrong, Kevin can make the mannequin do something wrong. You know, like if they give the wrong med, we'll put them into asystole or whatever.
So what's the first plan? What are we going to do in terms of?
Well, we're trying to get better at
To learn how to use it.
Well, I guess so.
Oh, yeah,
There's
you're
different,
right.
I understand there are different programs and different plans for different things and stuff like that. So, and I think Chart has some that they want us to focus on. Is that true or not true?
They gave us scenarios. They gave us like 5 scenarios to use. One of them is a code, one of them is diabetic, one of them was blood transfusion reaction, and I can't remember.
How about was there one for like rapid response where you?
Basically, yeah, that was the code,
That was
the
the
rapid
code.
response, yeah. Yeah. So,
But, we